Hi everyone. I got some feedback that the voice intervention skills class last week, was a little bit confusing at some points. So I pulled some of you to try and find out what exactly you're confused about. Some of you understood most of it, and some of you had more questions you wanted to find out about. So this short video is meant to clarify some of those questions that you might have. I summarized those questions into these three. The first is, what's the difference between holistic and segmental approaches, and direct versus indirect therapy? The second question that appeared to come up was, do I choose one or a combination of therapies that work on similar issues? And how do you choose the most appropriate technique? And the last question is, did I do it right? I think the last question is really a challenge, because in a class of 32, I cannot possibly look at each one of you do the therapy or demonstrate it for me. But perhaps what I could have done was to demonstrate it for you first before moving on. So I'll try to answer these three questions, and hopefully that will clear things up a bit. The first question, let's talk about the difference between holistic and segmental approaches. And to understand that, we need to take a look again at the power source filter model, basically the biomechanical setup. Now, you are very familiar with this. You understand that the power source filter model basically corresponds to three of the subsystems in this arthria: power meaning being respiration, source being phonation, and filter being resonance. The first thing I want you to remember about this slide is this: that even though we often try and target one subsystem, the three subsystems, in this case pertinent to voice, the three subsystems are dynamic in that each one interacts the other. Now, this is an important point to remember when we talk about holistic approaches in therapy. Okay, so it is a dynamic system. Each one, respiration has an impact on phonation. The way you close your vocal folds has an impact on respiration and airflow. The way you shape your resonance has an impact on that airflow and phonation as well. So each one of them interacts with each other. Now, bearing this in mind, let's talk about this slide, which is the main source of confusion. First of all, let's try and define what each of those things are. So on the top, you have direct therapy. What direct therapy means is that you're trying to affect the system of voice production. It's an active treatment. You do something to the patient. You teach them an exercise. You teach them a vocal technique. You get them to massage to release tension. It's direct, okay? When you talk about indirect, it just means that it's not direct. It's not typically used on its own. It's usually indirect therapy is usually used in conjunction with direct therapy. And an example of indirect therapy is voice rest, vocal hygiene, and potentially for psychogenic cases and people who are very anxious, sending them to a counselor or for psychiatric treatment. So if you understand the distinction between direct and indirect, the reason I drew this diagram this way is because most of your therapies that we'll be covering today and that you'll be using in voice therapy fall in the range of direct. Okay, everything is above the line. Below the line, indirect, you've only got a few: vocal hygiene, as mentioned earlier, voice rest, possibly counseling. Now let's zoom in on the difference between holistic versus segmental. Okay, let's look at the left first. So segmental just basically means that you're working on directly on single voice components. Okay, so for example, you might target respiration alone, like diaphragmatic breathing, or you might target phonation alone, like glottal stops or semi-occluded vocal tract, right? Or you might target resonance alone, something like twang or increased oral resonance by opening your mouth a little bit more. So that is segmental, because you work on a single voice component at a time, right? Now, if you go over to the right side, when you look at a holistic voice approach, what that means is that it reaches across many components at once, right? It may involve a single gesture, or a behavioral focus, but it affects the entire system, right? And the main aim of a holistic approach is to balance the three subsystems of voice production, right? So an example of something that's holistic on the right side would be LSVT, Lee Silverman voice treatment, or LMRVT, right? Lazak Madsen resonant voice therapy, or Casper Stone flow therapy, confidential flow therapy, I think. So those, when you look in their program, they do not specifically just target one thing, but they try and target a few things in general. Okay, so now that you understand what's segmental and what's holistic, this is where it gets blur. Okay, because if you go back to this slide, all three of these biomechanical subsystems are dynamic, they interact with each other. When you start working on the left side, when you start working on something segmental, it has an impact on the rest as well. Okay, so that's why it gets a bit confusing. On the other hand, if you do something holistic, right, if you analyze each of the individual exercises within the program, you might think, oh, wait a minute, that sounds segmental as well, right? So I think that's where the confusion might come. So it's easier then to look at this dichotomy between segmental and holistic as the way you approach it, okay? So if, for example, okay, backtrack a little bit, the only way you can plan proper therapy is if you first have a good assessment of what's going on, correct? Everything hinges on the effectiveness and the accuracy of your assessment. If your assessment, for example, identifies that there are there's a very specific breakdown at phonation level, but breathing is okay, resonance is okay, then you know very well what you want to target. Now, then you have to come to a decision. Do I go segmental and just target voice alone? Or do I approach it holistically and do an entire voice therapy, like entire resonant voice therapy, for example? Or do I target LSVT? And that's not such a simple question to answer, because it really is up to you. It depends on what you want to target, what you decide to target. And it also depends on what's suitable for the client, right? Some clients like the structure involved in approaching it holistically. They have very specific homework to go back and do. They can check off boxes, for example. Some people just like a quick fix, right? Some people respond better. It's not just what they like, but some people respond better to different tools that you might use with them in a voice therapy session. So I think that it boils back down to how do you choose between the two? It boils back down to how accurate your assessment is and how do you want to approach it. One brick at a time, or all three subsystems at the same time with the aim of trying to balance it out. Okay? So I think I hope that clarifies things. It has to come back down to your assessment and what you determine to be wrong with it. So based on that, that's how the treatment toolkit was designed for you. Basically, I organized it up into these various categories because it helps you to look directly at what you want to deal with at a segmental level. Meaning, if I think that I need to work with breath, just go into the breath section, teach whatever exercises you think is there. Each exercise, for example, has goals very clearly stated and what the objective is. So that should be clear enough for you to help you decide. Let's say, for example, I want to work on proper or better vocal fold vibration. I might try an SOVT, like semi-occluded vocal tract, or I might go into facilitating vocal fold closure, third from the bottom. So again, I stress it goes back down to what you assess the problem to be. Is the problem happening at the the power level, right? Is it happening at the source, which is phonation, or is there an issue with resonance? Okay, and that's how I would select an exercise based on the assessment. If you don't know what to do, because like many things are impacted at the same time, then it might be worth going into something a bit more systematic, like LMRVT or LSVT, with the aim of trying to balance those things. Okay, so let's go back to the 3 questions and see if I answered them. Okay, so what's the difference between holistic, segmental, direct versus indirect? I hope I've cleared that up. Do I choose one or a combination of therapies to work on similar issues? I would choose what works. So, for example, if I want to work on achieving better vocal fold closure, I might try a glottal stop, or I might try SOVT. And the one that gives me, the one in which the patient or the client is stimulable, is the one that I would choose. Okay. I would then develop my treatment around that. Okay. Let's say even if I chose to go down a holistic approach and decide to do resonant voice therapy, some clients require me to pull out little tools from the toolkit to work on one very specific point before they can move on. So I think this question is best answered by, it depends. You can choose one if that's necessary, or you can choose a combination of therapies. Okay. Now, did I do it right? The last question. So that brings me to the last point. Whether you did it right comes down to, let me go on to the last slide first. Comes down to next Tuesday. Okay, I wanted to talk a little bit about these, but I decided not to. So next Tuesday is going to be the intervention workshop. And I explained to you guys, I will be sending you a bunch of exercises that you need to go and learn on your own. And you'll have 5 minutes to demonstrate that to me. You will draw from a ticket, and then to help you to decide which one you need to demonstrate. It could be semi-occluded vocal tract, or you might have to teach me how to do a lip trill. And I'll send that list to you in the email. So you are allowed to bring in the notes with you, but what you need to do is to properly demonstrate it to me and teach me as though I was a client. So each of you have 5 minutes, and then I'll be able to tell you whether you're doing it right or wrong. Okay? So I hope this clarifies things. If you have any more questions, you can send it back to me via email, and I'll try to respond to you. Okay? All the best for the rest of this week, and I'll see you next Tuesday.